We have myself. أنا فهد أبوغيان، أستاذ مساعد استشاري في المدينة الطبية بجامعة الملك سعود، ومعانا الجستس الدكتور بدر اليحيى والدكتور عبدالعزيز المحلسي، الدكتور عبدالعزيز آل الشيخ، الدكتور محمد العقيل، والدكتور فواز التويجري who I think has something at 7:30, so he'll join us for at least the first half an hour or what's left of it. طبعا الدسكشن اليوم بيكون Q&A about emergency medicine in general. We have a few slides prepared by حنين ونواف يعطيهم العافية. If we can start with the first slide so we can focus our discussion on these topics at least. I think we'll have a limit of 2 hours for today. Hopefully we can finish before then. But we need to set at least يعني a deadline للموضوع اليوم. So I'll let my colleagues start with different answers to why you may choose emergency medicine as a specialty for your career. Let's start with whoever wants to speak first. Abdulaziz, Mohammed, please go ahead and share why you chose emergency medicine.
السلام عليكم. أنا عبدالعزيز المحلسي. بالنسبة لي أنا كان اللايف ستايل يمكن أهم reason. Emergency medicine gives you a bit of flexibility في حياتك to do what you enjoy outside medicine. والشيء الثاني التايب of work يعني إنه seeing acute sick patients, dealing with acute pathology. You see different things during your shifts. Your work is never routine. ما يجيك يوم نفس اليوم اللي بعده. فالشفتات تختلف بين شفت وشفت. فهذا واحدة من الأسباب الثانية من الأسباب اللي أنا برضو draws me للإمرجنسي ميديسن واللي خلت حببتني في الإمرجنسي ميديسن. بخلي الشباب الباقيين شير اللي عندهم. هذول بالنسبة لي top 2 reasons.
السلام عليكم.
تفضل عزيزي.
لا we'll go with who's older. It's you.
عزيز. ما أدري.
I'm not.
Hey, go ahead, Mohammed.
I'm not sure I'm technically older, but sure. السلام عليكم جميعا. محمد العقيل. And I just wanted to tell you why ما عندي قصة بس قصيرة مرة to tell you why I chose emergency medicine is once كان في كنت medical student على I think it was بداية الinternship و they called for a doctor on the plane. كان في medical emergency على الطيارة كان واحد hyperventilating بس أنا طبعا وقتها I didn't know what I was doing. I didn't know what was going on, but I was the only person there. And I remember thinking to myself أبغى أكون مفيد يعني أنا and I didn't know what to do, and they made the decision based on what I told them. مع إني ما أعرف شيء ولا أعرف من ربي حاطني بس I'm the most senior person on that plane. I realized something. Being an emergency physician means you're the most useful physician, and you're actually the most useful physician in and outside the hospital. Because if there's ever an emergency or there's anything going on, or even the simple things, you're useful. You're useful to your family, you're useful to your community, and you're useful in the hospital. You don't need an operating room. You don't need a CT scanner. So you're effective wherever you are. So I think that's one of my biggest reasons for going to medicine. تفضل يا أصغر مني سن الدكتور عبدالعزيز الشيخ.
السلام عليكم. طبعا I agree with whatever been said before. One of the things بالنسبة لي is shift work. So I like in unroutine scheduling. So I hate مثلا يكون جدولي ثابت من 8 إلى 5 مثلا يوميا الصباح. And I think shift work is a very one of the pros of emergency medicine. Fahad, maybe we'll have your answer.
Yeah, I mean, my answer is a combination of all of what you guys said. I think the biggest thing for me was the lifestyle. So I didn't want to have routine work where I wake up 7 in the morning every day and do the same thing on a daily basis. I think having work in different times for me gives me the opportunity to do things I like, maybe during the morning hours. Not having a routine when it comes to actually seeing patients. So you always get different set of patients every shift. You always get some new surprises every now and then. It keeps you on your toes. It's good. It's good for me in terms of not having the routine in terms of patient or hours. That's the biggest thing in terms of lifestyle. And I think that fits into the unique features of emergency medicine in general. The thing that's also important to know is زي ما قال الدكتور محمد العقيل, you're not only useful in the hospital, you learn tricks along the way that can make you useful for your friends and family outside. Maybe you'll be the physician that helps someone on a plane. Maybe you'll be the one who saves a life on the beach, whatever the case may be. So you learn tricks that make you beneficial to lots of people outside of the hospital as well. Go ahead, Badr.
Assalamu alaikum jami'an. This is Alyahya. I'm the youngest of all. So I would say the same thing. I like the shift work style, and I like to sometimes stack my shifts in the beginning or the end of the month, or put like some at the beginning, some at the end, and I have some space in between that I can do whatever I like. So I like the flexibility of emergency medicine. The other thing is the same thing as Mohammed said. You can be very valuable anywhere you go. Actually, yesterday I got a call from one of my colleagues in the hospital, who is not a physician but a healthcare worker, with someone collapsing in a restaurant, and the patient was not breathing. The person was not breathing, and simply she just needed to do a jaw thrust, and in a few less than a minute, probably, the patient started breathing. So you learn stuff in emergency medicine that you may not learn somewhere else. The other thing is you see a big variety of cases. You perform procedures. You see both surgical and medical cases. So I think that's the fun of emergency medicine. And above all, also you don't have to work morning every single day. You can change morning, nights, evenings, and so on. So that's it for me. Thanks.
Great, thank you very much. Now, I think this covers the reasons why we chose emergency medicine in terms of lifestyle and in terms of unique features of emergency medicine. Now, the question is, do you have any specific questions about these two subjects or not?
السلام عليكم ورحمة الله، مساء الخير على الجميع. إذا تكرمت وأنا عندي سؤال بسيط، ألا وأن الحياة كاستشاري، لايف ستايل كاستشاري، يعني الدكاترة اللي قدموا قبل شوي الله يعطيكم العافية، بس لو تذكرون إنه كل واحد يعني هل هو ريزيدنت، أخصائي، استشاري، لأنه في الغالب كريزيدنت أنت بتكون منكرف بأي سبيشاليتي، بس إن الحياة كاستشاري اللي هي بتقعد إن شاء الله معك 25-30 سنة. كيف الحياة كاستشاري؟ وبتكون شفتات أوقات آخر الليل أوقات الصباح، وبيكون وقتها تتزوج عندك عيال، فالحياة كاستشاري فقط.
ممتاز. طيب، اللي قدموا كلهم لك الآن كانوا استشاريين، كلهم استشاريين في قسم طب الطوارئ بجامعة الملك سعود. تمام. كلنا استشاريين أكاديميين. ما يختلف اللايف ستايل كثير ما بين أكاديمي وغير أكاديمي في جامعة الملك سعود يعني، أو الطوارئ بشكل عام. الاختلاف دائما يكون بينهم في عدد الشفتات، في الراتب على حسب عدد الشفتات، إلى آخره إلى آخره. فكل اللي تكلموا لك أتوقع أصغر واحد فينا تخرج من الطوارئ 2017، يعني خلص الطوارئ 2017. فأقل واحد فينا يعني مخلص البورد قبل 3 سنوات ونص. فيعني عندنا فترة كافية بعد البورد أن نعلمك عن حياة الاستشاري. أما بالنسبة للي سأل في الشات عن موضوع الإنكم، لسه ما وصلناها، احنا قاعدين نتكلم على موضوع اللايف ستايل واليونيك فيتشرز اوف emergency medicine. هل في أي سؤال على النقطتين الأولتين هذه من أي أحد ثاني؟ You can go ahead and raise your hand. تفضلي.
إذا ممكن بس تقولوا لنا على السوشيال لايف، لأنه as you said إنه it's very random، الشفتات وقتها مو ثابت، ف how does that affect your social life؟
ممتاز. I can start with this. طبعا emergency medicine for me is an excellent way of getting out of social commitments that I don't want to get to, because no one knows when you're working, so I can say that I have a shift at any given time. So it's an excellent way of getting out of any social commitment that you don't want to go to. The actual shift work, طبعا as a consultant، يعني خلينا من موضوع الريزيدنسي زي ما قلتوا من شوي، يعني you're going to do a lot of hard work for the number of years that you're in residency, so it's fine. What matters is what you do after residency. بالنسبة لي, I'm 5 years out. I'm almost 5 years out of residency. I'm still happy with my social life. As a consultant, if you do 10 or 12 shifts, and you don't want to get any extra income by doing any extra shifts elsewhere, then this leaves you with an excellent lifestyle in terms of having a lot of free time to basically do whatever you like or to see family and friends. That's how it is to me. Go ahead, colleagues. اللي عنده any additions to the question?
So I have to say, emergency medicine, something unique about it is definitely the lifestyle. I think it's a unique positive to it. الناس الثانيين مربوطين. الناس الثانيين مربوطين with their patients and their clinics. You can't hand off your surgical patients. You can't hand off your medical patients, not generally. But in emergency medicine, you're not tied to patients. You're just tied to a shift hour, and you can switch that easily with your colleagues for the most part. No one really cares if he works this weekend or the weekend after. And so you actually have some of the most flexible time frames compared to other تخصصات. And it's one of the unique reasons to consider emergency medicine. It's a positive rather than a negative. في السعودية, and this is, I think, important. You know, when you talk about poor lifestyle in other places in the world, people get compensated for working weekends and nights. Mostly, as far as my experience has been, it doesn't change whether you're working days or weekends or nights. Maybe it doesn't make a big difference here. So overall, it's a positive.
أنا آسف
عبدالعزيز بدر.
أنا معلش أنا جاني اتصال I missed the question.
The question was a social life as a consultant when it comes to shift work.
أشوف إنها excellent صراحة، لأنه you control your life basically. يعني يعتمد على المكان اللي تشتغله. متوسط الكونسلتنت من ناحية عدد الشفتات أتوقع بين 10 إلى 15 شفت، يعتمد على المكان اللي هو فيه بالشهر. ف you control how much you want to work. يعني إذا أنت في مكان تشتغل 10 شفتات, it's up to you. You can just work 10 shifts والباقي طبعا ما تسوي فيها شيء. If you want extra income you can work extra shifts. صح النايت شيفتس يمكن as you get old تكون أصعب. بس أنا مثلا بالنسبة لي أنا I prefer working nights أكثر من days. فدائما أحاول إني أشتغل nights or afternoons. فيعتمد عليك, هي personal preferences. بس اللي واضح إنه بعد لما as you get older working night shifts can be a bit harder than when you're a fresh grad. that's the only يمكن داون سايد من ناحيه السوشيال ورك، لانه بيكون عندك كوميتمنت اكثر، بيكون عندك كوميتمنت مع الاولاد، اذا انت عندك اطفال وتبغى تتاكد انت توديهم المدرسه يعتمد يعني. فذات's my answer.
Yeah, I guess I have nothing to add. Sorry. Yeah.
Thank you very much. Badr, do you have anything to add to what the guy said?
Yeah, I guess some people are concerned about like family stuff. Like I know emergency physicians for both, like the wife and husband are emergency physicians, and they actually find it advantageous as sometimes the wife takes the night shifts and the husband take the day shifts, and they organize it so they can manage the kids and also see each other. So I think despite some disadvantages, the majority would see it as an advantage. I know some physicians who works nights so they can spend the time with their kids when they during the daytime, and when they go once they go to school they sleep, and then they have some time before going to the night shift to spend with their kids. So I think it's useful to have a flexible schedule.
Excellent, I agree. Now we have one of the questions that says, is it true that the emergency physicians get burned out the most? My answer to this is going to be as follows. So it depends on a number of things. It depends on how much you work. So if you overwork yourself in any specialty, you're going to burn out easier. It depends on how you deal with stress. So you have to find ways to do things that you like in life to relieve stress. And that applies to all specialties, honestly. Some people adjust to night and day shifts and changing in between basically sleep schedule or sleep patterns. They adjust to it fine, and others don't. So if you don't adjust to switching sleep patterns easily, then it's definitely going to be something that affects your stress levels that leads to burnout earlier. That's going to be my answer to that. So it's definitely variable. So it depends on how much you work and how you find ways to relieve stress. In terms of the schedule, I think we've answered that. Su'al min Abdullah Al-Qahtani. Is it flexible? Absolutely, it's flexible. We've answered that as well. How many shifts for a consultant? It depends on where you work. After you finish the board, it depends on what level you're at. So the number of shifts for an assistant consultant is different than that for an associate consultant, is different than that for a full consultant, and it's different from one organization to the other. So the definition of a full-time consultant is different from one organization. Our workload is different from one organization to the other. Can you get more than 12 shifts? Absolutely, you can work as many as you want. It depends on how much work you're willing to put in and how many places you're willing to work at. And it's basically a matter of adjusting your schedule accordingly. هذا عبد الله القحطاني. بعدين we have most of the physicians later complaining of night shifts. They tend to be a part of administrative work rather than full-time EM physician. How do you overcome this problem? It depends on how much you love emergency medicine and seeing clinical work. I think this problem of switching to administrative duties comes for a lot of healthcare workers after they're older in age, further along in their career, and they want to phase out of clinical work, so they reduce their clinical loads gradually until they are completely out of clinical work and they're purely administrative. That's my answer to that question. Is there a limit to how many hours shifts you can work? I don't think there is any official limit. I mean, it depends on how many you can do, but you have to do a balance that works for you, that keeps you sane, and it keeps you functioning well and happy, and it doesn't lead you to burn out earlier. We'll talk about the cons of emergency medicine in a second. Workload in university hospital is more different than in Ministry of Health hospitals. Absolutely. The workload is different from one hospital to another, and the workload is different if you're an academic staff or not, because you have academic duties. So it's different. Can you work in different hospitals simultaneously? Yes, you can. Especially if you're an academic in a university, then you're officially allowed to work in private hospitals as a per diem, which means you pick up shifts as you want every month, or as a part-time. I don't know, does anyone else from my colleagues have any questions, have any answers that are different, or want to add to the questions I just asked? If you want to go over the questions there in the chat.
No, I think Fahad, you answered the most questions in the right manner. So بالنسبة لكم any more question about lifestyle of emergency medicine يعني that you want to ask about before we move, I guess, Fahad ولا لا?
Yeah, I don't see any more questions. Okay, wait, we have 2 more questions. هل الدوام 8 ساعات أو 12 ساعة؟ يختلف من مستشفى لمستشفى، بس الأغلب 8 ساعات. في علامة استفهام، بس هذا سؤال يعني ما فهمت علامة الاستفهام، أرجو التوضيح.
لا أتوقع أنها تقصد على can you work in different وين هذا؟ لا do you think it is easy to deal with frequent changes in sleeping pattern؟ هذا السؤال حق العنود، فحطت استفهام شكله تأخر الاستفهام.
اوكي اي واضح. I think for me personally I don't mind switching my sleep pattern. I have no issues with it. But there are certain recommendations in terms of batching your night shifts together. The things that you do before and after the night shift, how you eat during a night shift, so you can adjust your sleeping pattern earlier, so on and so forth. Go ahead. If anyone else has a different answer to the sleeping patterns, go ahead.
Yeah, Fahad, if I may say something, I have very fixed sleep pattern, and I find it easy if I have 2 days off after my night shifts before I switch to days, and that doesn't cause any problem. If I change that, sometimes I have difficulty with the first morning shift after a night shift. But if it's 2 days in between, it's totally fine. And most hospitals make sure that when they schedule people, they give you two days off at least before you switch to the day shifts.
Good, thank you very much, Badr. Does anyone else have any comments about sleep patterns?
أنا عندي تعليق بس يعني إحنا I think we're all a bit young I think that's it. يعني just my experiences يعني برا you see more senior physicians what we train with, but generally when they tend to slow down clinically, they tend to move away from doing nights and evenings because they fatigue more of doing it. But I think that's the point, is that that's an option, is that you can predominantly in general most places to consider that. When you become more senior, you can become a more fixed in your, rather than do the alternating shifts, which is overall like shift work everywhere. It's not really long term, is not the healthiest thing in the world. You know that. Because currently, I don't think any of us struggle with it.
I agree. So some of the questions now that are coming up: is it better to be an academic? If yes, how? I don't think you can say it's better to be an academic or not. I think it depends on what you want in life. If you want to be an academic, that means that you'll be more involved in teaching students. That means that you'll be more involved in curriculum, basically development for the student courses in your specialty. It means that you will have to be involved in college-related, let's say, committees and councils that are related to the college and not to the hospital itself. So it depends on what you want. Some people are in it just to get the title of assistant, associate, and then professor. They want to be called professor at some point in their lives. So it depends on what you want. يعني you can find pros and cons for each. So that's really all I have to say about that. لحظة. I have a question about pressure. The pressure of work, is it differentiated from hospital to hospital? Absolutely. لأنه الhospital يعني طبعا كل يعني each hospital has its own number of patients that they see. Each hospital has its own acuity of patients that they see. So it's definitely different from one hospital to another. And no one, I guess, can disagree with that. So it definitely, you have to ask before agreeing to sign a contract with the hospital as a full-time practitioner. You have to know the number of patients that they see, and you have to know the acuity of the patients that they see, and if that matches what you want or not. ممكن توضحون نظام الشفتات أكثر. يعني ما أتوقع في توضيح صراحة أكثر من كذا. الشفتات عدد معين. You get to put in requests. يعني مثلا نظام عندنا في أحد يمسك الجدول بغض النظر عن مين هو. You submit requests for what you want, and it's basically on a first come first serve basis. You may get all of your requests, you may not, but I think يعني most of the time you do because it's easy to switch the shifts around. Even if you have last minute changes, I think your colleagues are willing to switch shifts last minute, and it shouldn't be an issue. If you're not an academic, you can't work in two hospitals. I think it depends on which hospital you work in. يعني حتى if you're not an academic, you can be a part-time consultant in another hospital. So it depends on your department and your hospital that you work in. They can give you what's called I think an agreement that you're okay to go to one center other than your primary hospital to work as a part-time. How hectic can the shift be? It can be from extremely boring to extremely hectic from one shift to the next. So an example, today I started at 7 a.m. I had two pulseless patients before 11 a.m. So, or before 12 noon, I think. So you can have extremely busy patients with shifts with 6 patients, and sometimes you can have extremely boring patients where shifts where you do nothing. So it depends on the day, and this is one of the things that makes me love emergency medicine, is no shift is like the other. We'll talk about the downsides in a second. طيب, anything to add, Badr, Abdulaziz, Mohammed,
maybe
based on these last questions?
Yeah, maybe we're assuming that people understand emergency medicine. So I'll try to explain how shift works further. So basically you have a number of shifts per month. So يعتمد على المستشفى على contract to your side. But let's say you have 12 shifts per month. These shifts usually out of 8 hours, عندك شفتات morning, evening و nights. غالبا 12 ثلثهم بيكونون morning, ثلثهم بيكونون evenings, and ثلثهم بيكونون nights. And usually زي ما قال فهد الباقي you request your shift, so timing with days off. Usually people are very helpful in your department, and usually the scheduling should go smooth. هذا what usually happens. What else? That's I think the only thing I'm just gonna add.
Okay, so go ahead.
في حسام كان رافع يده، ما ادري اذا حسام يبغى يتكلم عن السؤال بس نزل.
كنت بسأل عن إذا ما كنت أكاديميك أقدر أشتغل يعني في other hospitals، بس جاوب الدكتور فنزلت.
شكرا.
ممتاز. طيب الحين we can move on to pros and cons. I think we've talked enough about the pros يعني because it goes under why we chose emergency medicine, and we spoke about that in the beginning. We can talk about the cons. This time I'll let my colleagues start first, and then we'll move on afterwards to the income, in terms of income for the emergency physicians. Abdulaziz, Mohammed, Badr, if anyone has any comments about the cons of emergency medicine, when it comes to you personally, what do you think?
So let me start, Anna. So I think one of the cons of emergency medicine is sometimes the stress of the stress. So when you have a full emergency department, you're feeling the pressure and that there's a lot of people waiting and you try to juggle around. That's part of it. Sometimes the system is not helpful. Sometimes, especially if the system doesn't help you move your patients around, either your output or your input in the hospital, that can be pressure. That's why people sometimes get burned out in emergency medicine. I think that's the main two problem usually I face.
I would second that. I think the downside of emergency medicine is the gates are always open, and you can never control the number of the patients that come through, and you can never control the acuity of patients that come through. So sometimes you can have shifts from hell, whether let's say if Al-Malik Khalid Al-Jami, you're in the resus or you're in the acute care. You can be pressured by the number of sick patients, and they're all sick, and you want to deal with everyone at the same time, and you want to get things moving. So you feel pressure to deal with all these sick patients who came in at the same time. So you can have multiple codes at the same time. And it definitely increases your stress levels during that time. And when you're in the acute care, if you have one sick patient that you're dealing with, it may increase your stress levels. And if not sick patients in the acute care, you may have a high number of patients that you want to see, and you don't want to keep them waiting, and you feel the pressure is all on you to get these patients moving. So it depends really on your personality, on how responsible you feel to fix everything that's wrong with the system that's affecting the throughput of the patients, that's leading to you not being able to move the patients quicker. So يعني أنا أشوف إن هذه one of the biggest challenges for me in emergency medicine. It's not like an internal medicine clinic where even sometimes you can have overbookings and it can become a little bit hectic, but they're all relatively stable patients who can wait, and then you can take your time with each patient. But most of the time it's scheduled patients that you can see 15 minutes or 20 minutes max each, and you can get through them. That's all I have to say about the cons, honestly. Anyone else from my colleagues who wants to add anything about the cons, or should that cover that portion? If there's anything specific to yourself, please share it with us.
I'd like to share something. I think something more specific to emergency medicine is that it's very conflict heavy as far as hospital goes and hospital. That you just the nature of it, you deal with very anxious people, you deal with people who have been waiting for a long time, you deal with people who are really worried, sometimes they're really sick, and you deal with family members. And you deal with a lot of consultants who you create work for, and you have to advocate for your patients, then you have to advocate for your department. So you end up having a lot of conflicts with patients, with specialities. It's just the nature of how it works, wherever you work. And if you work in a well-supported and well-structured emergency department, then generally these things are less, because there's like good security in place, there are good protocols in place, and there are, and there are good pathways to prevent, you having conflict with specialties who don't understand that the priority for the emergency department is to keep seeing patients and make sure you don't miss a sick patient. So I think that's something you have to keep in mind. You're going to get into a lot of conflicts. You have to be someone who understands that and is willing to deal with that. If you're someone who doesn't deal with conflict, then emergency medicine is definitely not for you.
And also, if you, I second that. And also, if you cannot deal with the stress, it's a high stress specialty. So you deal with a lot of sick patient, you deal a lot of agitated patients, sometimes if they're psychiatric. So you have to deal with the high stress. If you cannot deal with that, you cannot compose or control yourself, I think emergency medicine is not for you.
I agree with both Mohammed and Abdulaziz said. I think that it is a conflict-heavy specialty, and you definitely have to know how to deal with these conflicts. And if you're not a person who deals with conflicts very well or doesn't want to, then this definitely is not the specialty for you. One of the questions, before we move on to the questions, does anyone else from the guys want to share anything when it comes to the cons of emergency medicine?
I think emergency medicine, just to point something, I work in the ICU and I work in the emergency department. I think emergency medicine is a very exciting specialty. It is a fun specialty, but it's not an easy specialty. But if anyone thinks that going through emergency medicine is the easier path, that's not true. I think emergency medicine as a job, you deal with a lot of high-risk patients. You deal a lot with زي اللي تكلموا عنه الشباب, other issues outside of medicine. It's not an easy specialty. It's a very, very challenging specialty, but it's a fun specialty. And to me, and I think حتى emergency medicine, when I work in emergency shifts, emergency medicine shift, I find them harder than my ICU shifts for a lot of reasons. بس إنه برضو it's more exciting sometimes. That's my 2 cents.
شكرا Abdulaziz. طيب, if no one else has anything to add in terms of the cons of emergency medicine. تفضل حبيبي, تفضل.
بس إنه في رغد رافع يده إذا if you don't see. If you want to give her the floor, maybe she have a question.
If you allow me, I would like to ask about when you get older, because of the shifts مرة يتعبون. if you go to a clinic, you are not as tired if you attend a shift. So this with age, how can you deal with it? احنا لما نكبر نتعب أكثر. How can you comment on that?
المشكلة كلنا صغار, بس go ahead.
بس أنا لما كنت أسوي الICU fellowship حقتي كنت أشتغل في clinics sometimes. I could not stand the clinics. أنا أشوف إن clinic أتعب. بالنسبة لي هي عشان كذا personal preferences. أنا بالنسبة لي أدخل الشفت أطلع أحس إنه I don't find the shifts أصعب من الكلينيك. أنا بالعكس أنا أشوف الكلينيك way harder than the shifts. بالنسبة لي أنا طبيعتي وشخصيتي ما أقدر أتحمل الكلينيك. Whether كانت simple clinic ولا busy clinic, إني sitting in one place doing the same thing over and over and over again is not something that I can do. فيعتمد هي goes back to your personality. If you find yourself finding a shift صعب عليك now, definitely emergency medicine is not for you. Just keep that in mind. والشيء الثاني طبعا ما احنا كلنا نوعا ما fresh grads, ما لنا فترة طويلة ما احنا fresh grads بس ما لنا فترة طويلة practicing emergency medicine. فما نعرف, ما عندنا 20 سنة 30 سنة في الER. صعب ان هذا, بس انه انا I know كان عندنا مثلا في المكان اللي سويت فيه الريزيدنسي رئيس قسمنا عمره 60 وما زال practicing emergency medicine. نائب رئيس القسم عمره يمكن 55 وما زال يسوي بس نايت شيفتس. ففي ناس يشتغلون, في ناس هنا في السعودية leaders في الامرجنسي, they still work in emergency medicine, they still find it enjoyable and they still work it. وعادة يعني senior physician they tend to get more morning shifts than the junior physicians anyways.
I second that. Well, another thing you can keep in mind is that you can always downgrade from full-time to part-time, and then you're not tied down. So if you find something on the side that's administrative or in education or in consulting, such as with the Ministry of Health, there are a lot of pathways you can take, and you can do less number of shifts. Another way to cope is some people switch to morning only shifts when they become more senior. So there are a lot of ways that people adjust to whatever their preference is, but it's different for different people. يعني أنا مثلا أتخيل نفسي بعدين إنه I would still love to come to night shifts, بس I can't speak for myself إذا الله أعطاني عمر بعد 10 ولا 15 ولا 20 سنة, and would I still feel the same way? I don't know, but I still have the option of choosing by seniority morning only shifts, ولا morning and evening and not doing nights, ولا cutting down on the total number of shifts, so on and so forth. So we have a lot of options to deal with that. How do you mentally cope with seeing a lot of deaths and accidents, and does it affect your social life? To me, in the beginning, it was tough. I think it's different from case to another. You have to separate your social life from work. You can't bring your social life into work, and vice versa. You can't take your work to home. So you have to find the ways that suit you personally to deal with the stress related to the shifts. People like myself take it out on physical activity. I vent to my colleagues, أتوقع Abdulaziz, وبدر ومحمد, hear a lot about my complaining about some certain patients that I didn't like the outcome with, about certain shifts that things didn't go on like I wanted. But you have to find the way that suits you. If anyone else from my colleagues wants to add to that, or we can move on to the next question.
Fahad, if I may say something, as you get senior in emergency medicine, you become comfortable with so many cases, and probably the stress of the shift is not as much as when you're a junior physician, so that maybe helps also. The other thing is venting, as Fahad said. I do call all of the guys here about when I feel like I need to talk, and we are good at this, and we understand each other, so we always support each other. And that's about it. Thank you.
Excellent. Thank you very much. طيب, ممتاز. If no one else has anything to add about that, we have a few more questions to go through. Can you talk about the different hospitals and their systems? I think this will take a lot of time, but the short answer to this is that it's definitely different from one hospital to the other, but the average number of shifts is like my colleague Abdulaziz said, is 10 to 15 shifts, depending on your position, depending on the hospital, and depending on how many non-clinical duties that you're involved with. بس لنفترض مقارنة بالتخصصي. التخصصي has a higher number of required shifts, but has a higher income. So there's a trade-off. King Saud Medical City اللي هو شميسي, you have a lower number of shifts but lower income, somewhere in the middle between الملك خالد الجامعي if you're academic and التخصصي. So it depends on where you work. This may change by the time you guys graduate, because they're working on making things a little bit different in healthcare. But the short form of it is, like I said, it depends on your position. It depends on whether you're a full consultant or not. It depends on the institution, and it depends if you're academic or not. That's the short form of it right now. We can't get into exhaustive details because it would take this on its own as a session. Studying during residency, is it hard and take time? Can you compare the load with medicine and surgery? I think we have one of the residents with us, Sarah معانا. I think she can go ahead and answer this. She can give you her يعني experience this far into the first year of residency with us in the emergency medicine program في جامعة الملك سعود. Go ahead Sarah.
السلام عليكم، حياكم الله جميعا. ويعطيك العافية دكتور فهد وباقي الدكاترة، شكرا جزيلا. أتوقع أن I missed the question، بس عدا الله يعافيك.
The question is how do you compare the load with studying? يعني can you compare it to medicine and surgery during residency ولا لا? In terms of clinical load زائد studying.
أوكي تمام. طبعا حنا تذكرون وقت الانترنشيب كان عندنا دراسة الاختبار صح؟ تبع اختبار الهيئة وكذا. فأنا جربت أدرس وقت السيرجري، جربت أدرس وقت الميديسن، بعدين الحين يوم صرت ريزيدنت من R1 الحين، وجربت أدرس الحين اللي هي منهج ال ER مع اللي هو الدوام. هو بالبداية بتلاحظون الصعوبة، عرفتوا يعني طريقة ترتيب الشفتات، متى أدرس، هل هو قبل الشفت هل هو بعد الشفت. بعدين تكتشفون مثلا الجدول يكون شفتاتكم عبارة عن كلاسترز، يعني مثلا عندكم 4 شفتات هذه نايت تمام، فترجعون من الشفت ترتاحون شوي أو مثلا تنامون، تقدرون تدرسون باقي اليوم لين يجي الشفت اللي بعده وكذا. وتقريبا as a resident as an R1 يعني as a junior بشكل عام يكون عندكم 16 شفت خلال الشهر، ويصير أصلا في وقت يعني في وقت دراسة، في وقت إنكم تطلعون. بصراحة كنت متوقع الوضع stressful أكثر من كذا، لكن لا الحمد لله مرة في وقت مرة كثير، لكن بالبداية في صعوبة بس بتتسهل مع الوقت. تمام، هذا اللي بتلاحظونه مرة كثير. في أي سؤال ثاني؟
الله يعطيك العافية سارة.
يمكن بس أعطي تعليق على الموضوع هذا. يعني obviously I'm further out from training، بس ما my experience was for residency إني كنت أشوف كل يعني كل الناس معارفي وأصدقائي اللي معي في تخصصات ثانية عايشين في المستشفى medicine surgery، وأنا يعني حسيت residency was very reasonable، وكأني كنت أكثر شخص يمكن يعني قدرت أسافر وقدرت أروح أكتشف وأشوف أماكن. فأحس بالعكس it's one of the better residencies as far as lifestyle. نهاية الموضوع ما حد يقدر يقعدك زيادة، ما أنت قاعد ساعة ساعتين زيادة في الشفت إلا لو you're consulted or wants to stay long. Well, you can't even stay longer. فما هو زي الأذر تخصصات أنت قاعد as long as your team قاعدين and there's more room for I guess some unfair actions done by consultants. But yeah, I think it's a big positive ناحية lifestyle.
في سؤال أبغى أجاوب عليه اللي هو اللي يتكلم عن do you think it will be harder to find a job as a consultant level بعدين في hospitals in the near future. أتوقع it depends. إذا أنت تتكلم عن emergency medicine في الرياض I think it is true for most specialty إنه in the near future حيكون صعب إنك تلقى positions في الأماكن اللي تبيها في الرياض. If you think about which specialty بيكون أصعب، ما أتوقع الemergency بيكون من أصعب specialties. أتوقع it will be actually one of probably the easiest specialty to find a job في الرياض، يعني لأنه الرياض أصلا متكدسة بالأطباء. زين لكن في hospitals لسه عندهم need emergency medicine consultants. في أكثر من مستشفى في الرياض في need emergency medicine consultants. بعدين في مستشفيات كثيرة غير اللي هي المستشفيات الحكومية، في مستشفيات خاصة، في مستشفيات جامعية. طيب emergency medicine has always a need، يعني لأنه shift work فتحتاج one physician per shift يعني minimum، يعني في اليوم لازم تحتاج at least three physicians per day. غير التخصصات الثانية مثلا لو قارنها فرضا for cardiology أحيانا بعض المستشفيات يكفيهم 3 cardiologists أو 4 cardiologists، ما يحتاج أكثر من كذا. I think من ناحية الأمان الوظيفي الemergency still there، و I think it's still going to continue to be okay especially إذا ما عندك if you're not tied location wise يعني أو مستشفى بحد ذاته specific hospital، اتوقع لسه في الفيوتشر از برايت من الناحيه هذه.
اجريد عبد العزيز يعطيك العافيه. طيب بعدين في EM is usually associated with the excitement and thrill. Thinking long term, how do I know if it's worth a few days of thrill in a high stressful specialty? That's something that you have to make the decision upon. Is it something that you love enough to do for the rest of your life or not? Knowing that, which answers the next question, can you switch from ER to administration? اسمها emergency department مو emergency room بس للتوضيح. ED مو ER. You can switch from emergency medicine to administration of hospital whenever you like, depending on how much involvement in the hospital administration and the opportunities that your institution is. So it's something that you can, if you lose interest later on, you can easily switch to non-clinical things to do without any issue. I think that's the short answer to it. You create a path for yourself depending on how much involvement you have with the institution you work for. Can you please talk about the teaching center and which one is the best for residency? I'm not experienced enough to know the difference between the teaching centers, but I think the Saudi program in general is excellent by seeing the graduates of the Saudi program. And I'm one of the believers that regardless of where you do residency, if you're good, you're going to be excellent as a physician during residency and afterwards. And if you're not, then it doesn't matter where you do residency, you won't be good. It depends, طبعا, whether you're good or not depends on how much work you put in and how much effort and how much you really want it. So that's my answer to that. Does anyone have, I think we answered this question, how saturated the specialty in Riyadh. تكلم عنها الدكتور عبدالعزيز المحلسي من دقيقتين. Does anyone else have anything to add in terms of these questions? Abdulaziz, Badr, Mohammed.
يعني أنا أحس إنه بعض الأسئلة إنه they think إنه أو أنا أحس من بعض الأسئلة إنه people think about the emergency department or emergency medicine as a specialty where you go in just for the acute stuff and the thrill والcardiac arrest والtraumas والأشياء هذه. لا هي هو specialty زي السيرجري زي الميديسن. It's very complex, it's very big. ما هو شيء صغير ولا محدود. it is you should think about it مثل التخصصات الثانية as when you think about surgery ولا medicine. It's the same thing. طيب هو big specialty, it's a huge specialty. الرينج حقه جدا وايد. في sub specialties يطلع منه. ف when you go and try it out, if you think it is stressful, if you think it doesn't fit you, then you shouldn't go there. لأنه to be honest زيها زي السيرجري، الامرجنسي ميديسن زيها زي السيرجري، زيها زي الانستيزيا، زيها زي الميديسن. كل تخصص fits a specific personality يمكن. طيب أو fits ناس عندهم goal معين. فالبرسوناليتي حقت الامرجنسي ميديسن اذا رحت وجربته وحسيت انه this doesn't fit you من ناحيه اللايف ستايل ولا من ناحيه انه it is too stressful ولا then probably it's not the best specialty for you. نفس الشيء لما تروح تجرب السيرجري، اذا تحس انه السيرجري انك توقف في الاو ار مده 8 ساعات و10 ساعات something that you don't want to do، وانه الستريس اللي مع السيرجري is a very stressful specialty بعد. نفس الشيء if you feel you're too stressed out لما تكون في السيرجري، نفس الشيء with medicine. ف think about it that way يعني.
ممتاز. Does anyone else have anything to add? I think we've talked about that in detail. ممكن تتكلمون عن المنهج الدراسي. هل لازم أعرف كل شيء وهل يقارن بالباطنة؟ ما السؤال صراحة غير واضح. It's a specialty زي ما قال الدكتور عبد العزيز, like every other specialty. You need to know what you need to know عن specialty. That's really the answer to that. يعني فكل specialty لها main reference و a few other sub references. يعني you need to know what you need to know in that specialty. My recommendation is if you join residency in emergency medicine, choose at least one case from every shift that you know the least about. Read around it. Keep doing that until you perfect that specialty, that disease, and move on to the next, and so on and so forth. طيب, can you talk about subspecialties opportunities in Riyadh? بصراحة يعني there are a lot of opportunities that you can do in Riyadh. في pediatric fellowship, I think we have an ultrasound fellowship coming up. We have disaster medicine fellowships come up in Malik Khalid Al-Jam'i. You have, I'm not sure if we have a toxicology fellowship in Riyadh yet.
Starting soon.
Yeah, but it's coming on the way. And then whatever you do in administration, you can do through a master's degree and through your work in the institution that you're at. So these are all things that you can consider في من ناحية subspecialties في Saudi. Obviously, there's ICU as a subspecialty. You can do that. What else can you do? طيب, isn't it hard to have to study nearly everything? You're not studying nearly everything. You need to know a lot of things for each specialty, and emergency medicine is one of them. So you need to know what you need to know for emergency medicine. Can you give us a brief view about fellowship options after residency, locally and internationally? I think that's coming up in the next slide, but let's talk about this slide first. How does it affect your social life? We've already talked about the social life aspect. Income-wise, where does ER stand between other specialties? How much do they make on average? طبعا income highly depends on how much you want to work. It depends on whether you're working in a as added emergency medicine shifts, or you work in a non-clinical part-time or full-time position, and then you do extra shifts on the side. So it's highly variable. Where does it stand? I honestly don't know what the income is for other specialties, بس اللي يبي يحصل شغل ويبي يحصل income, you won't have any issues finding work, at least not for the time being. You can make as much as you want for the time being.
And I think emergency medicine is a high-paying specialty بصراحة. It's not plastic surgery. It's not. شوف, يعني you have to think about it. If you want to make a lot, really a lot of money, you have to be a proceduralist. يعني someone who does a lot of procedures in private institutions, زي plastic surgery, زي مثلا الديرموسيرجري, زي أو الدرماتولوجي, بعض الدرماتولوجي اللي هم الديرموسيرجري, maybe ophthalmology, ENT, اللي يسوون procedures. طيب, I think in comparison to medical specialty, I think it pays more than medical specialties. I think it comes halfway between the surgical specialties والmedical specialties. In terms of income خارج المملكة, this is where emergency medicine, it's halfway between medical specialties and surgical specialties. هذا اللي أتوقعه.
Yeah, I think that makes sense.
Yeah,
I think that makes sense. حلو. If no one else has anything to add, we can answer the next question. Yeah, go ahead, Mohammed.
Yeah. I just wanted to say something in the first question about, do you need to know everything? No one needs to know everything, and no one can know everything. But the good emergency physician knows enough about the presentations that he sees that it makes him comfortable during the shift. And emergency medicine is one of these things where you have people who can be exceptional and people who can be mediocre. If you're a mediocre physician, you can still skate by having other specialists come in and take over, and like you just consult away, become essentially like really what other specialties will call like a triage nurse. Like until you're just تحول على كل أحد because you don't know what to do. But a competent emergency physician knows where patients need to go and knows how to disposition patients and knows what they need. So the more you read, the more competent you are, the easier your life will be, the more your consultants will like you and respect you, and the smoother your shifts will be. And obviously, the better care you're going to provide to your patients. So that's where it lies there. For that's my personal opinion about how much you need to know. And just تعليقاً على income, definitely you make more than the medical specialties. And any زي اتفق مع الشباب جميعا في كل التخصصات في most places in the world, if you're a proceduralist and you can do a highly reproducible procedure and you can offer it in settings that are like private, etc., no one's going to beat you as far as income. That's always the maximal income anywhere you work generally. But you definitely make more money than the internal medicine specialties or internet specialties.
معلش بس عندي تعليق على البراكتس والكنولج اللي you need to know. I agree with all of you guys, with Mohammed, and we have a scope of practice. So you will, when you go through training, you will know what are the limits, the things that you need to know, and at what limit you need to stop and get another opinion or move the patient to a certain specialty. Same as other specialties. They know once they need to consult someone or ask help from someone or move the patient somewhere else. It's the same thing. So we have a clear scope of practice. Once you go through training, you will understand this.
I think برضو بس في شيء as an attending physician or as a consultant يمكن my view انه هي والcritical care I think that both specialties, واكيد في specialties الثانيه بس هذه other specialties انا ما اعرف عنها, بس اتكلم عن الspecialties اللي انا اعرف عنها, اللي emergency medicine والcritical care. Both of them you need to keep reading بعد الرesidency. I think this is true for all specialties. بس فيها يعني الديماند عالي عليك كemergency medicine لانه you need to know updates about a big scope. يعني you need to know the updates عن الكارديولوجي, you need to know updates في trauma, you need to know updates في أشياء كثيرة, neurology. You need to keep updated to continue to be an excellent emergency physician. فيمكن الديماند في القراءة أنا أشوفها يمكن عالي بعد الريزيدنسي. وبعدين نرجع مرة ثانية الإمرجنسي ميديسن زي كل السبيشالتيز الثانية فيها تكست بوك معتمد ينقرأ منه, تكست بوك واضح, في له البروجرام دايركتور بيعطيك جايدنس on what to know, وش الأشياء اللي لازم تعرفها وش الأشياء اللي مو لازم تعرفها. فنفس الشيء زي مثلا internal medicine بيكون عندهم مثلا هاريسون بيقرون منه, السيرجري عندهم تكست بوك, هنا عندنا روزنز وتنتنالي واحدة منهم. ففي شيء واضح, ما راح يعني ما راح تدخل ريزيدنسي وما انت عارف وش تقرا ولا من وين تقرا.
Excellent. Thank you very much, guys. طيب, for the sake of time, because we set the limit of 2 hours, what's expected of me as an intern or a student when I'm in the emergency department? I think the biggest thing that bothers me nowadays is when I come to the emergency department and I see medical students sitting down on their phones for the whole shift, not interested in terms of participating because they're not interested in the specialty. I think regardless of what your interest is, you should show interest wherever you're rotating. And if you were put in that rotation for a reason. You need to know specific things about these rotations. So try to make the most out of it and don't look bad. This is even more true if you're interested in emergency medicine. يعني أنا ما يقهرني اللي يجيني intern في بداية الشفت, السلام عليكم أنا فلان ولا فلانة intern معاكم, بعدين يتهربون نص الشفت, بعدين في آخر الشفت oh can I get a recommendation? No, this is not the way it works. If you want a recommendation, you have to actually prove yourself, and proving yourself doesn't come from 1, 2, 3, or even 4 shifts. If I'm giving you a recommendation, that means that I'm giving my word to whoever's reading it that you're actually good. I can give you a recommendation that says you're average, you're not so good, but that I'm not doing you any favors when I'm doing that. So if you want a recommendation, you have to commit to it. If you want to commit to it, show interest, put in the effort. And this applies for all specialties. This applies for all rotations, whether you want a recommendation or not. You should give it your all, because it's not, you weren't asked to do this for no reason. That's my the short answer to that question. So the expectation is show interest, see patients, discuss, ask questions. Things are not clear, try to make them clear. Always show that you're interested in seeing patients in the case itself that you saw, regardless of whether you like the case or not. And then give options on what you think the process that's going on with the patient is, and what you want to do, and how we're going to investigate for it. That's my answer for that. Does anyone else have anything to add from my colleagues?
Yeah, وبعدين الريكومنديشن اللي تنعطى الويت حق الريكومنديشن يختلف من شخص لشخص. طيب اذا اخذت ريكومنديشن من شخص مثلا يكون عنده يعطي generic recommendation or a lot of recommendation to anyone who asks for it will not hold في الابلكيشن حقك. It won't be as strong as getting a recommendation from someone that doesn't give recommendation إلا someone who actually and truly deserve it. You need to put in effort. You need to put in work to deserve the recommendations والstrong recommendation اللي يخليك تدخل residency program. الجايد لاين حقتي اتوقع اول شيء واهم شيء، وهذه شفتها كثير للاسف. Do not lie. لا تكذب. If you lie, that will get you out. It will destroy your chances مع الشخص هذاك. يعني لما الكونسلتنت يسالك سويت فحصت البطن، اذا ما فحصته لا تقول فحصته، قل له ما فحصته نسيت. That's fine. It's okay. لكن do not say that you did something that you didn't do. لانه احيانا يكون لما يروح الاتندنج والكونسلتنت يشيك على المريض ويكتشف انك ما فحصت الجزء هذا، ولا ما سالت عن السؤال هذا، ولا you actually lied about the question اللي سالك اياه. That will destroy your chances, and that we shouldn't do that لانه can change the outcome حق البيشنت. في اسئله مهمه انتم يمكن ما تعرفون اهميتها. It could change the outcome حق البيشنت. فبي careful. Show up early. لا تختفي في نص الشفت. If you need to go buy coffee or something, tell the consultant about it ولا resident. وبس يعني be professional. That's all.
I think Abdulaziz summed it up for that part in terms of knowledge, because that's one of the questions in the chat. What you learned during medical school, you're not expected obviously to know everything in the emergency department. As an intern, you're there to learn, so it's okay to ask questions. It's fine. Yani, as an intern, I think if you see a patient, ask the right questions that you learned in history taking and exam taking when or performing. When presenting, you ask the right questions. You performed a good examination. You presented it well. And you have at least 3 differentials and the plan of what you want to do to rule in or out these differentials, I think you're on the safe side. And I think that about sums it up for what's expected of a student or an intern in the emergency department. Moving on for the sake of time, how to increase my chances in matching. So resume, research, etc., etc. I think I would leave this question specifically. Dr. Badr Alyahya is the program director للemergency medicine program في الجامعة، وعبدالعزيز آل الشيخ الأسيستنت program director. So I'll leave this to be answered by them.
Assalamu alaikum. I think it's a common thing that everybody does is to look at your performance during medical school, to look at your GPA, to look at your exam results from the SMLE, and also to look, more important, to look at your to look at you. Did you work with us during your internship? Did you were you interested in emergency medicine? Did you show clear interest? Did you show clear knowledge? And who do you have references from? Someone that we trust and we know does good assessment, as well as the interviews skills. If during the interview you're someone that I know everybody would like to work with, then that's give you a great chance. So it's multifactorial. It's not one thing. I will let Abdulaziz answer the rest if he has anything to add.
I agree with Dr. Badr said. So let's just divide it. So you have to work to increase your chances to be accepted في هيئة التخصصات. So you match to emergency medicine. And no one can choose you if you didn't match through هيئة التخصصات. So it's a point. So you have to understand how you get those points. And if you get lucky and attached, then the next question is, I want to go to a specific center. I think for the specific center, you have to do elective in the specific center. You have to show interest. And when you come do elective, you do it, and you do it, you show passion and you show commitment. So زي ما قال دكتور عبد العزيز المحلسي انك you become professional. Professionalism is very important to us, and also it's showing that your presentation skills, how you think, all that can make a difference. If anyone have specific question about how to increase his chances, we're more than happy to answer.
I would like to stress on the fact that even though things on paper are good, if you come and you're not professional during your shift, or so you come late, you're not showing interest, yet you say, I want to be in emergency medicine, or you have some attitude issues, I think these will make all of the good things on your CV go away. So you're not expected to know everything in emergency medicine. This is why there's a residency program for this, because we just want to make sure that you're a trainable person and you're not going to be more trouble than what's worth training you. If you're not a trainable person because of attitude issues or because of not being professional, I think that's a big no-no for anyone to be accepted in any training program, whether it's emergency medicine or not. So professionalism and attitude, personality are big things to be looked at as well. طيب, if no specific questions about that, I'll run quickly through the questions we have in the chat. But Haneen, you can move on to the next slide. The first question that we didn't answer is, since emergency physicians work with less data and little time, does this increase the risk of making more medical mistakes? I don't think it makes it more than any other specialty. It depends on a number of factors. Not all patients are in any specialty are going to come to you with textbook presentations. I think paying attention to details in history and physical examination can give you a lot. If you set yourself with, let's say, your own approach where you have at least the top differentials for the presenting complaint and how to rule them in and out, you're on the safe side. Whenever your spidey senses go up or you have concerns about patients, I think it's rather better to be safer than sorry. So I'll give you an example. I had a patient who had a very weird presentation just before I finished my my shift. I couldn't discharge this patient or refer him to medicine because I had a sense that something else was going on. So I needed imaging. I could have gotten him out of my hands and become a triage nurse, زي ما قال الدكتور محمد. But I felt something else was going on and referring him wouldn't be the best for the patient. So I decided to order imaging and sign him out to the night shift team with the plan to at least see what the images show before referring him to the proper specialty, because he was not going home, and that was for sure. Do you care about research and applications as much as other medical specialties? I'm not sure I have the right answer for this one, but I think it's a plus if you have research in other in addition to other aspects of what's required of you to be matched in the Saudi Council or the Saudi Commission. طيب, what books do you recommend before taking an elective? I don't recommend that you read any books related to emergency medicine. I think before the elective. I think knowing the basics at least في specialty, وزي ما قلت, if you take a proper history, a proper examination, and present it in a nice way with a detailed plan after discussing at least 3 differentials for the presenting complaint, you're on the safe side. In terms of small books that may help you, I can't remember the name of the book. واحد كان, I think, EM cases أو emergency medicine case files أو شيء زي كذا, والثاني كان الثاني, I personally would like you to read Rosen's, but not the whole thing, obviously, just the cardinal symptoms or cardinal complaints for the first few chapters. I think that would give you a good idea for taking history and examination and ruling out or in the top differential diagnoses. And I'll leave my colleagues with that to see if they have any added recommendations in terms of book. Do you care about research? We answered this. Or should we focus on volunteering and getting special certificates such as ATLS? I think each one of these components, the more you have, the better your CV looks. But sometimes you working in elective with the right people and showing interest and having the right personality may get you higher points. I'm not sure. I'll leave this to Abdulaziz to answer, to be honest.
So when it comes to research, yes, it counts. As Fahad said, it does count. It will increase your chances if you do good research. Unfortunately, what we see from previous years is bad quality research. And I don't know how, you can't even call it research. You're filling your CV with these. And then when you get asked, it's hard for you to answer. So I would rather not to see these in your CV and see some other activities or working in emergency with some experience or getting some good references from someone we trust. But good research, of course, will give you credit. I think that's when it comes to research. There was another question. Sorry, I forgot. What was it?
The recommended books, Badr.
Yeah, maybe. What you mentioned is great. I think Baby Tintinali is also reasonable. It's easy to read, and it has good information as a beginner. There is a first aid review, a small review for emergency medicine that can be helpful also. That's about it for me.
And I think for the books, maybe I can add Tintinali, just the facts, maybe short and just to the point, so it can be good at your level.
Mumtaz, thank you very much. طيب, related to that, what classes are recommended to attend before the residency? I'm not sure what you mean by classes. If you mean by courses, then I think what's going to be required of you as an emergency resident is that you should have BLS, ACLS, and ATLS. I'm not sure about PALS, honestly. Maybe Badr or Abdulaziz can answer that. If that's what you mean by classes, then yes, these things are the ones you should do. But when you take these courses, don't take them just for the certificate. Please actually learn what they're teaching you because it's helpful for you as a resident. Tamam? Because some people go and try to figure out what the questions are that they want to ask and just answer those to get the certificate. The idea is, yes, the certificate is required, but again, it's required for a reason. You're supposed to actually know what the content is. So focus on learning what the content is, and that's going to be good for you. I don't think that there's any ambiguity around that question. So for the sake of time, we have around 38 minutes left. So let's move on. As a resident, local or abroad, I think I've answered this before. If you're going to put in enough effort and work, you can be a successful emergency physician, whether you do your residency في السعودية ولا برا. That's number one. If you choose to go abroad, please don't waste life. Please set yourself up with a timeline that I want to have this plan going forward. This is the time I want to take if I'm applying to Canada, the MCCEE, and the USMLEs if I'm applying to the States, and I want to have a limit of 2 or 3 years. If I'm not successful in getting a position in the US or Canada by 3 years, then I will switch my efforts elsewhere. Don't waste your life, because in the end, again, you need a certificate, which is a board certification, and you can get it by هنا ولا برا, and whether you're good or not depends on how much effort you actually put in learning, and that's the whole idea of residency. Does anyone else from my colleagues have anything to add about that specifically, or can we move on to the next one? I guess that's a no in terms of local or abroad. Okay, so the residency program, we have rotations, shifts, exams, and other activities. The residency program, I think, is a little bit different from one center to another in terms of best arrangements. بس يعني في الأخير, the composition of the requirements of the program, since it's regulated by الهيئة السعودية للتخصصات الصحية, is all in all the same. But I'll leave this question to be answered by Abdulaziz or Badr if they want to.
Yeah, so basically, so rotations تقريبا, so it's a 4 years program. So you have different rotation as an off service ولا in service في emergency department. The shifts usually is 16 for R1s, 15 for R2, 15 for R3, and 14 for R4. Exams, you have 2 major exams. The first part, but then that's, you can do it after your first year or second year, and the final exam, اللي هو board exam. Did I cover it right, Badr or Sarah? Sarah maybe she.
اي دكتور. بالنسبة لنا احنا 4 سنوات الريزيدنسي، فعندنا أول 2 as junior years، بعدين آخر 2 as senior years. السنة الواحدة تقريبا مطلوب منكم انكم تغطون 7 شهور تكون emergency، بعدين عندكم أورثو، عندكم OB، بعدين مثلا عندكم بيدياتريك، as an R2 عندكم نيورو ICU CCU، فتختلف على كم ليفل. أنا بشوف لو عندي جدول أو كذا أو رابط أحطه لكم بالشات عشان تشوفون الخطة كاملة لكل السنوات.
طبعا during the training the major exams زي ما قال عبد العزيز, بس you have also the assessment exams. So these are to encourage you to read and to make sure that you're doing the right thing that you're supposed to do during your training. It's just a form of assessment. That's about it. And rotations are they're fixed. Every resident in Saudi does the same rotation, except for your electives. You have a few electives during your residency that you can do mostly whatever you like. But the core rotations are the same in every hospital.
Mumtaz, thank you very much. One of the questions says, I'm a 4th year medical student interested in EM. As a medical student interested in EM. I have 4 researches, yet none of them is for EM. Is this going to present me as not interested in EM? I don't think that the expectation is that you decide what specialty you want in medical school. A lot of people decide later on. I'm one of them. So as long as you've actually put in the work in doing research, you're fine. So it shouldn't be an issue. طيب, moving on. The available fellowships locally and abroad. So there is a wide number of fellowships for the emergency physician. Once you graduate from residency, you can do POCUS, which is the point of care ultrasound. You can do ICU. You can do toxicology, pediatric emergency medicine, disaster medicine, emergency medical services. You can get into leadership. You can get into simulation. You can do resuscitation. You can do medical education, I think. Medical education and administration, I think, are open to all specialties and not necessarily for emergency medicine. POCUS is going to be something that I think medicine, ICU, and emergency medicine can do. Pediatric emergency medicine is open to pediatricians and EM physicians. I think one of the questions earlier was, is it better to do pediatrics, whether as a pediatric emergency medicine through pediatrics or through emergency medicine? I think it depends on what you want in life. If you do it through emergency medicine, you can work in both adult and pediatric emergency medicine. If you want to do clinics for general pediatrics and then do shifts in pediatric emergency medicine, then that's going to be the way you want to do things. So it depends on what you want. There's no way better than the other. It all depends on you and what you want. طبعا الفellowships اللي ذكرتها بعضها موجودة هنا وبعضها موجودة برا. Again, it depends on what you want. Are you okay to go in terms of scholarships now? I'm not sure how the situation is going to be by the time you guys graduate from residency, but it seems that we're heading towards يعني إنه everything becomes local. I'll let my colleagues elaborate more if they have any ideas or any comments on that.
Yeah, so just maybe circling back, really, is it local or abroad? زي ما قال Dr. Fahad, if you're good, you're going to be good anywhere. But it's good to see other systems. So if you have the chance and you go somewhere else, I would advocate for this. It gives you something intangible, like experience, seeing different systems, seeing different how people, other people, how do they do their clinical work and lifestyle. So can give you something intangible. So I think if you have the chance, you should go for it. Does it make a difference? I don't think it makes a difference in your career wise.
Okay, so if no one has anything else to add, we can move on to the next slide. في one of the questions, what's track A or track B regarding residency? Whoever talked about that, please elaborate.
I don't know what's that. I'm not sure.
I think doctor he means the joint program.
كيف؟
أتوقع إنه يقصد الانترنشيب تراكس صح؟ لأن عندنا تراكس من A, B, C بعدين D و F.
ما أعرف عن الانترنشيب لكن في الريزيدنسي ما في تراك A وتراك B.
I think he means about the joint program in emergency medicine tracks.
For us, our program is the independent program. There are some joint programs, but I don't think it makes a big difference with regard to training, or it depends on your interest, which center you want to be trained in, and centers may have some small variation, but at the end, it's the same program.
Okay, I guess that answers that. هذه كل السلايدز خلصنا؟
Doctor. Yes, doctor.
Okay. Does anyone else have any specific questions? If you have any questions, you can raise your hand or you can type it in the chat, whatever makes you feel more comfortable, and then we'll answer them. Otherwise, we can close. طيب كم الوقت المتوفر بين كل shift? It depends on how your shift schedule is. I'm not sure how it is for residents, but I think they cluster the shifts, 3 or 4 shifts, and then you have a break for a few days, and then you go back for 3 or 4 shifts, and so on and so forth. As a consultant, again, you put in your requests ahead of time. You can have them all together. You can spread them out as much as you want. It depends again on you, on the institution, and the scheduler. Well, it depends obviously on the number of shifts that you have. Do you think it could be harder for lifestyle-wise for females? Honestly, I don't think so. لا, it depends. It depends on. It's different from one person to another. I think I made the mistake of not arranging for any of my female colleagues to come on with us. That should have helped in answering these questions. But I'm more than happy to have them have at least one of them, one of my female colleagues, join us next time we meet, and maybe we can direct the question to them. I cannot speak on their behalf, but from what I've seen during my residency and fellowship, I don't think that I've noticed that it was any more difficult for my female counterparts, for our female counterparts. طيب لحظة أشوفك رافع يدك يا عبد الله، بس دقيقة واحدة خلينا نخلص قراءة الأسئلة اللي موجودة هنا. What is part-time in EM? No, part-time in EM is not half a shift, it's half the number of shifts. So some hospitals, لنفترض مثلا المستشفى الملك خالد الجامعي, whenever we have a shortage in the number of staff and they open up part-time jobs, we open up a part-time position which is 8 shifts for a set amount of compensation, and then you do 8 shifts for the number of months of the contract itself. So that's what part-time is. In other hospitals, it's per diem. هم يسمونها part-time, but it's actually per diem. It means that you sign up with them, they do the credentialing, they finish everything, and then you pick up as many shifts as you want or as available in the schedule, and then you get compensated for that later on. Can we manage between family and kids and work? I can't speak on my female counterparts, so we would have to actually invite them next time and see what they think. But when it comes to kids, I feel equally involved with my child as my wife, and I don't see any issue with it from my end. But I never got pregnant, or I didn't have the child, or I never did any breastfeeding, so I really can't speak to that. So next time we'll have at least one of my female colleagues come on with us, and they can answer the specific questions related to females in emergency medicine. طيب, any other questions? في عندنا مين كان رافع يده؟ لحظة. Abdullah, I think. Abdullah, go ahead.
السلام عليكم ورحمة الله وبركاته. الله يسعد مساكم جميعا. وأولا شكرا لكم على هذه على قولتهم المحاضرة الحلوة اللي فهمتنا بالإمرجنسي ميديسن، لأني كنت متردد والله. عندي سؤالين. السؤال الأول ممكن يكون شوية برايفت، إذا تسمحوا لي. أول سؤال، متى الشخص أو الطبيب يقدر يشتغل برايفت؟ اللي حسب ما فهمت إنه يتفق هو المستشفى الملاك الخاص فيه، بعدين يشتغل برايفت. هذا السؤال الأول. السؤال الثاني، كم الشفت الواحد كم ياخذ كأقل شيء؟ والسؤال الثالث معليش زدت سؤال. السؤال الثالث إذا عاد فيك الزمن لجميع الأطباء الموجودين عندنا ومع كامل احترامي لهم، لو عاد فيكم الزمن تدخلون emergency medicine أو لا؟ إن السؤال هذا راح يوضح كثير، وألف شكر لكم.
شكرا عبد الله. طيب السؤال الأول can you work part time؟ زي ما قلت لك حسب الاتفاق بينك وبين المستشفى حقك. النظام العام إنه إذا أنت ما تشتغل في برايفت إلا إذا أنت كنت أكاديميك ستاف في أحد الجامعات. الوضع الواقع أن أي أحد في أي مستشفى يقدر يشتغل في الحبيب من دون أي ورقة، أو أي مستشفى خاص ثاني شفتات بير ديم من دون أي ورقة من المستشفى الخاص تبعه. وهذا عشان نكون يعني صريحين وواضحين على بلاطة. إذا بتشتغل برايفت في مكان as a regular full time ولا part time then you need اللي هو التكليف أو الإعارة أو الإذن من المرجع. هذا السؤال الأول. السؤال الثاني كان إيش كان السؤال؟ كان عدد الافريج انكم بير شيفت. اوكي، الافريج انكم بير شيفت حاليا تقريبا 3000 ريال لكل 8 ساعات. هذا تقريبا الافريج compensation للامرجنسي فيزيشن بير شيفت. تمام. you may find a plus يعني 200-300 ريالز. في اماكن ممكن تدفع اقل. depends على how busy the place is and how much they're willing to pay. بس هذا الماركت برايس للامرجنسي فيزيشن حاليا. وكان السؤال الاخير لو عاد فينا الزمن، بخلي الشباب كلهم يجاوبون، بس انا I would absolutely 100% go into emergency medicine again. مع العلم انا سويت 5-year residency. I would still do it all over again. It was tough. يعني it was not an easy journey. بس I'm proud of what I accomplished. I'm proud of where I am today, and I would definitely do it all over again.
Yeah, I can't think of other specialty that I would do other than emergency medicine. بالنسبة لي.
Same here. I would go back and do emergency medicine.
باقي محمد العقيل وعبد العزيز المحلسي. I'm not sure إذا هم موجودين لسه. عبد العزيز موجود ومحمد موجود. طيب ممتاز. Let us know. Would you go back and do emergency medicine all over again?
Like I said, I would definitely do it again. I wouldn't do anything else. I wouldn't. I never thought twice about it.
ممتاز. عزيز.
I think he's busy, but I am definitely can answer for him.
أي أنا 100% sure that he would do emergency again. طيب just so you know, الدكتور بدر اليحيى البروجرام دايركتور he did emergency medicine and then toxicology as a fellowship. So if you want to expand on fellowships later on, we can talk about them. الدكتور عبدالعزيز آل الشيخ سوى emergency medicine بعدين سوى sports medicine as a fellowship. الدكتور محمد العقيل سوى emergency medicine followed by ICU. عبدالعزيز المحلسي سوى emergency medicine followed by ICU زائد ultrasound. طبعا الفوكس حق الاي سي يو حقه كان كاردياك اي سي يو ومعاها اللي هو الفوكس الالتراساوند. انا سويت emergency medicine followed by administration and an MBA. كانوا simultaneous يعني at the same time. But we have a good variety in between us, and if you want to expand the talk about fellowships, we can make it on its own later on. We can gather more يعني colleagues with different subspecialties to talk about the fellowship options. موجود عندنا شخص إن شاء الله من كل subspecialty. We can combine that with a talk separately about doing if you want to do emergency medicine abroad, we can speak to that emergency medicine ولا الفellowship abroad, then we can speak to that as well in the same session, limited by 2 hours. اللي موجودين اليوم أنا سويت الامرجنسي ميديسن في ماكماستر وبعدها الفellowship في جي دبليو. عبد العزيز المحلسي سوى الريزيدنسي في جي دبليو followed by الفellowship في يو سي اس دي. الدكتور عبد العزيز آل الشيخ سوى الريزيدنسي والفellowship في ميغيل. الدكتور محمد العقيل سوى الريزيدنسي في ميغيل. وين محمد العقيل سوى الريزيدنسي في ميغيل والفellowship في فانكوفر. وبعدين الدكتور بدر اليحيى سوى الريزيدنسي في اوتاوا والفellowship في ميغيل. صح بدر؟ اي اوكي كويس.
صح.
ممتاز. So we can talk about these later on in any other sessions that we arrange for in the future. Do you have any questions or should we close? طيب يعطيكم العافية جميعا. سم.
لا كنت بقول بس أنا معليش أنا طلعت شوي إذا في أي شيء أي مست ولا أسئلة أي مست لي أنا شخصيا ولا لا؟
لا كان جاوبنا عنك. كنا بنسأل إذا أنت ممكن لو رجع فيك الزمن هل ترجع تسوي emergency medicine وقلنا إيه خلاص.
إيه.
ما فيها شيء.
ما فيها كلام.
خلاص عارفين الجواب. أي طيب الله يعطيكم العافية جميعا. شكرا الدكتور عبد العزيز والدكتور عبد العزيز، دكتور محمد، دكتور بدر، ما قصرتوا أبدا. I hope this answered the questions that you guys had. Hopefully we'll have other productive sessions in the future. We'll let you know when the next one is after we arrange for it إن شاء الله. يعطيكم العافية جميعا وفي أمان الله.